name's Jenna. I am a 7th semester nursing student. It is March 2nd at noon. Today I will be performing med administration and NG tube removal. Prior to going into the patient's room, I will ensure that I have orders for meds. I will make sure that the client has been removed off of tube feeding for at least 30 minutes in a section as well. Prior to going into the room, I will have completed 2 medication checks, and I will crush my medications and then instill them in 20 milliliters of water, making sure that they can be crushed. So I also have gathered all of my supplies, so I'm going to go into the patient's room, perform hand hygiene, put on some of my gloves. Provide privacy. Hi, Mr. Smith. My name's Jenna. I'm going to be taking care of you today and giving you some medications. Can you tell me your name and date of birth? Okay, good. I'm going to move the client to working height. Have him sit up for me. I'm going to place a towel. Alright, so there are a couple ways that we can check NG tube placement. You can aspirate the stomach contents to check the pH, and you can also instill 10 to 30 milliliters of air. So I'm going to go ahead and do both. So I'm going to go ahead and clamp the NG tube, pull residuals. And then I will follow agency policy whether to reinstill the residual or get rid of it. The policy I follow says not to, so I'm going to go ahead and get rid of that. And then I'm going to go ahead and instill around 10 milliliters of air there. Place my stethoscope and listen for the swoosh. I heard a swoosh, so we're in the right spot. Go ahead and declamp this. And then check my pH. My pH is around 5, so it looks like we're in the right spot. And now I'm gonna do my 3rd medication check. I'm gonna scan the ID, scan the meds, everything's good. So we're going to be going ahead and giving you your Tylenol and your Zyrtec today. Can you tell me your pain on a scale of 0 to 10? Okay. All right, so now we're going to go ahead and we're going to begin the med administration. So I'm going to unclamp my tube. I'm going to go ahead and I'm going to flush my tube. Have gravity help me a little bit. Go ahead and I'm going to draw up my medication. Make sure there's no air. patient. Alright, once that's done, I'm going to go ahead and re-clamp my tubing, making sure not to hook the patient up to suctioning for 30 to 45 minutes or resume feeding per tube for 30 to 45 minutes. I'm going to lower the patient back down, clean up my mess. Are you doing okay, Mr. Smith? Good. Make sure my patient has a call light within reach, and then whenever I leave the client room, I'm going to make sure to document that I gave medications, how I checked placement, and then the amount of flush that I used in between medications. And so now it's a couple days later, and I have an order to remove the NG tube. So I am going to gather my supplies. So I need my flush and my towel. And I'm going to make sure I have an order to remove. I'm gonna enter the room, perform hand hygiene, put on my clean gloves. I'm gonna make sure that if the patient has been receiving tube feeding, that the NG tube has been clamped for at least 30 minutes before I remove the tube. I'm gonna raise the patient up, explain to them what they're doing, ask for name and date of birth. Can you give me your name and date of birth, Mr. Smith? Good. Okay, so we have an order to remove your NG tube. So we're gonna get that removed for you today. Are you having any nausea or vomiting since the tube has been clamped? No? Okay. Just gonna listen to your bowel sounds real quick. Okay, bowel sounds are present, so we're good to go ahead and remove the NG tube. So I'm gonna go ahead and place the towel under the client. I'm going to remove the tube from the gown. Or if the client was hooked up to suctioning, I would remove it from suctioning. I'm then going to instill around 20 milliliters of either sterile water or air. So I'm going to go ahead and flush it with air. G-tube. And flush it with air. Okay. All right, Mr. Smith, I'm going to remove the tape from your nose. And then I'm gonna have you take a deep breath in, and I'm gonna remove the NG tube, okay? Deep breath in, 1, 2, 3. Awesome. Okay, I'm then going to get rid of my NG tube in the trash, lower the patient back down. Are you doing okay, Mr. Smith? Good deal. Make sure that he has his call light in reach. Before I put the NG tube in the trash, I inspected the NG tube to make sure that it was intact. And then I'm going to document that I removed the NG tube, if there was any drainage and the characteristics of the drainage, and also how the patient tolerated the removal. And then I would give up his call light and exit the room.